to InnoHealth Conference 2024. I am Anjali, your host today for InnoHealth Magazine podcast, and here I am with Dr. Shirshendu Mukherjee. Welcome, sir. Sir, can you little bit introduce yourself so that people can know?
Thanks for this opportunity. I am Shirshendu Mukherjee, basically a microbiologist and a medical microbiologist by training. Almost 30 plus years of working in this field, especially now supporting innovative solutions to develop affordable innovative solutions for our country in India and beyond.
Yeah.
I've been also heading the Grand Challenges India portfolio, which looks at challenging innovations, which are challenging problems which our country faces and finding out solutions for them. And also I was heading mission COVID Suraksha, which developed 4 vaccines which our country needed to tackle the dreadful COVID problem which the global community faced. So I think on and on, I am a funder, basically working with funding agencies, supporting innovations which literally can create impact in our country, India and beyond.
Yeah. So sir, how was your session? Can you share some insights from the session?
This session, I think we paid rich tribute to Rear Admiral Singh, who has been a mentor to a lot of us. He was a person, he was a clinical doctor himself, served with the armed forces and then with the Navy. But, always with the innovative thinking and innovative ideas always with him. I think he literally excited many people when he was in service.
Yeah.
And when he, hung up his service dresses and came into, after his retired life as well, he was literally created this Innovating, which literally worked with innovators, supported innovators, to starting from, I have done a couple of grant writing workshops with him, where he used to help innovators how to write grant writing, where to get grants from, how to identify innovation, how to address unmet need through innovations, and then take it forward so that our country can develop affordable, accessible and quality innovations which can impact patient life in India and beyond.
Yeah, I agree. So sir, let's start with the questions. So what's the most inspiring example of healthcare innovation you believe can have a global impact on healthcare? Maybe in India or globally?
See, there are a lot of, the innovation has to be looked at from a very, very angle where it can be really impactful.
Right.
Innovations can be of many kind, but the innovations which are impactful, which can address a very strong unmet societal need, in affordable, it should be accessible, and it should be of quality.
Right.
I think if these 4 or 5 bullets are ticked in innovation, I think that is the innovation which the country needs.
Yeah.
Innovation can be done in a research lab also, but if that innovation is put it into a research publication or is in the shelf, that doesn't make any sense.
Right.
So innovation has to be such, it should reach to the common man,
Right.
in affordable, accessible, quality innovation, then only I feel that innovation is impactful.
Yeah.
And that innovation is worth supporting and taking forward.
Yeah, I agree. So, sir, what are some of the most significant obstacles you have seen innovation getting in healthcare? Real world.
See, the innovation in healthcare, there are a couple, obstacles will always be there in any path you walk.
Yeah, I agree.
And I remember a very good saying by Swami Vivekananda, that day you do not come across with a problem or obstacle, take it for granted you are trotting on the wrong path.
Yeah.
So I think obstacles has to be in every step of innovation.
Yeah.
But we have to strategize a way to take innovation to the next level.
Yeah.
Innovation is such that we should not think that innovation can be done only in the lab. एक हाथ से ताली नहीं बजती. Innovation has to be a team group.
Yeah.
In healthcare especially, it has to be a team, a 360-degree team. You have to have a basic scientist who understands, who designs the innovation. then a clinical person who literally validates, who looks at innovation, whether it can be implementable, because without clinician, you can't take a healthcare innovation to the next level.
Yeah.
Then you have to have a regulator advice into it, whether it will address the regulatory standards of our country. There are a lot of time intellectual property issues. Then comes the business plan, that how to produce that innovation, how to market that innovation, how to get the innovation into the government system. That needs to be there. So everywhere, then finally the funding it, the whole path of innovation.
Yeah.
So I think everywhere we will have a challenge, but I feel that if the science is good, the team is good, I think, and the advice is good, I think we can address all the problems and cross the barriers.
Yeah, right. Yeah. So, sir, how has you seen innovation evolved from the years in healthcare, and what it is capable of for the unreserved communities or people who do not have access to most of the innovation in healthcare?
So if you see the innovation ecosystem since last 1 decade, it has moved from literally very strong way. And why this has happened is the government support for innovation has increased multifolds.
Yeah.
These days, no innovator can complain that I don't have funds to do innovations. All funding is available for innovations.
Yeah.
So that is the first step. But I work in a funding agency. We look for good projects to be funded.
Yeah.
Good projects is good science, good team, and good exit strategy or storytelling. I always tell innovation is just like a fairy tale. You have to understand that. Fairy tale, if you have read sometimes, it starts with once upon a time and ends with a line called happily lived ever after. So innovation has to have that sense into it. So I think if every innovation has, and that is what I am telling you, that you asked me it should impact the community. We have to think reverse. That what is the gap in the community?
Right.
How the innovation can address that gap. How science can support that gap. Then you come back and look at what are the scientific platforms which can address that and take it to next levels. I think that will be the best way forward.
Yeah, I really like the answer. So thank you so much, sir. Thank you for your advice and your suggestions you provided, and I'm excited to have some insights from the session you already had. So thank you so much, sir.
Thank you, Anjali, for the time. Thank you. Bye.